When you think about businesses that are selling through the roof, like Aloe or Allbirds, sure, you think about a great product, a cool brand, and great marketing. But an often overlooked secret is actually the businesses behind the business, making selling, and for shoppers, buying, simple. For millions of businesses, that business is Shopify. Nobody does online business better than Shopify. It's home of Shop Pay, the #1 checkout in the world. You can use it to boost conversions up to 50%, meaning way less carts going abandoned and way more sales going through to checkout. Sign up for your $1 per month trial period at shopify.com/income, all lowercase. Go to shopify.com/income to upgrade your selling today. That's shopify.com/income.
Shh. Hear that? Big waves are calling. Dive into refreshment with Kona Big Wave. Tropical flavor and the taste of aloha in every drop. So crack one open and let the great taste roll in. Kona Big Wave. Liquid Aloha. Copyright 2025 Kona Brewing Co., St. Louis, Missouri. Mahalo for enjoying responsibly.
Hello everybody, it's Gareth. Welcome along to Somewhere on Earth. It is Tuesday, the 12th of August, 2025. And with us today is the excellent Angelica Mari, live and direct from Sao Paulo. I guess, are you calling in from home? Is that where you are?
Yes, I'm recording from home, and it's quite freezing today here, Gareth. It's we just weathering the winter here.
It's still the winter time down there.
Yes.
Okay. Well, we're about to swap weather with you, I think, as the hemispheres
Once you can brag.
swap round. So for now we can brag, but the boot will be on the other foot. The meteorological foot will be on the other boot. That's two, I think, metaphors I've mixed there, but it will be. Give it a few months, and I'll be the one complaining about the cold. Believe you me. But anyway, we'll keep everybody warm with some great technology podcasting. Here we go. And coming up today, it's the selfie that tells you whether you're healthy. Yes, this week we tell you about the app that can tell your heart rate just from scanning your face for 60 seconds. The app also does a voice scan to gauge your mental health. I've tried it and I had a bit of a surprise. And we find out about the platform that's helping black mothers in Brazil with employment and mentoring. And it's all right here on the Somewhere on Earth podcast. So I've had a health check in the last few days, not at the doctor's, but using an app on my phone. Basically, I put in a few details like my height, my age, and my weight, as you might expect. But the big surprise came when the app told me to hold the phone in a selfie pose for about a minute. Just from scanning my face, I ended up with all kinds of data, including my heart rate. And after the face scan, then I had to do a scan of my voice. I had to speak for about 40 seconds describing a picture that appeared on the screen. From that, the app could gauge aspects of my mental health. Now, this is just one part of a platform called Medsi AI, and the firm behind it is based in Mexico. And it's responding to a health crisis in the country. 40 or 50 years ago, Mexico's health system was built mainly for a pediatric market. But these days, with an aging population, Mexico has a more mature society, and the health system just isn't designed for it. Not only that, but most healthcare spending in the country, about 55%, comes directly from individuals. Most of the population has no health coverage at all. So Medsi is working with the Mexican government to bring better health coverage to more people. And that app that I've just described, it isn't available publicly. This podcast was granted exclusive access, so you won't find it on any of the app stores. So let's hear more now from the founder and CEO, who is Manuel Villalbazo, about how a prolonged selfie really can tell us so much about our health.
So we are scanning the face and we are basically looking at what's going on in the blood vessels under your skin. And from that, we are able to measure vital signs, including your heart rate, your oxygen rate, your blood pressure, and even things we call them bloodless blood tests because we are measuring hemoglobin and hemoglobin A1C, for example.
Right. So how does it do that? I mean, just looking at the face, I mean, unless I know that you're going to tell me otherwise, my phone doesn't have an X-ray functionality. All it's doing is just looking at the surface of my skin, and it can tell all these things just from your skin surface. Then can it?
Well, actually, what it's doing is we are concentrating in the light spectrum in three different frequencies, and we are measuring the amount of light that is being either absorbed or reflected back using your phone's camera. And that enables us to recreate what is happening under the surface of your skin. So in the hypodermis where the blood vessels are. And that is what allows us to, we're basic, if you've ever seen a Doppler ultrasound, that would be more akin to what we are seeing as we process this information with deep learning algorithms.
So how accurate is it? I mean, obviously you've tested this thing, but I'm just amazed that you can that the app can draw all these conclusions just from 60 seconds of my phone held in front of my face. I haven't given a drop of blood. I haven't breathed into anything. How does it know?
The way we've achieved that is we've calibrated this with hundreds of thousands of readings where we are comparing these tests via traditional devices, medical grade devices, and then we are comparing it with the information that we are getting from these readings. And by doing that, when with machine learning, you are able to get great levels of accuracy. I should mention that we are the first company in the Western Hemisphere that has, and that is outside Asia, anywhere outside Asia, that has a regulatory approval for our FDA equivalent in Mexico as a class 2 software as a medical device. So basically, what that validates is that this is just as accurate as medical grade equipment that you would find in a hospital. So yeah, to your question, we have developed all of these different parameters over time, but for the first ones we brought into the market, we're looking at 0.997 accuracy. So it's very, very accurate.
Wow. But how about with darker skin? I have lighter skin, so you might be able to see issues related to my blood vessels and so on in my face. What about with darker skin?
We have tested this. There's a scale. It's called the Fitzpatrick scale that maps skin tones from one, the lightest, to six, which is the darkest skin. And we have tested it across the whole scale, and there are no meaningful differences. But on the same note, you could probably ask, and we've done all of these permutations in our regulatory approvals, with a beard, no beard, with glasses, no glasses, makeup, no makeup, all of those permutations. So the regions where we are focusing are really unobstructed. So in the upper region of the face, from the nose up, and yeah, this is equally accurate across skin tones.
Now, the next thing is you can do a voice test, can't you? Tell me about that.
And we're very excited about that is one of our most recent developments. So if you think about what happens when we speak, it's really a complex neurological process, right? There's a lot you have to coordinate a number of muscles with your vocal cords and obviously all of the content that is coming from your brain, right? So in that, there's a lot of information embedded. And again, by interpreting certain patterns that we can find in speech, from anything from the tone to the coarseness or the stability or of the voice, it doesn't need to analyze the words themselves, the content of the speech, but from the acoustic and linguistic characteristics of speech. You can also extract a lot of information about the cognitive state of a person and emotional factors, including depression and anxiety.
Well, but this is where it gets interesting for me because the one with the face, I sailed through that. I'm well healthy, according to your app. So I did the same thing for my voice. And I was trying to use positive language because you've just told me it's nothing to do with the language you use. It's just listening to the voice side of the voice. But I was trying to describe this image that comes up on the screen. You're meant to describe it, using lovely positive adjectives. But I didn't trick your system. I was amazed. It actually said that I'm stressed. And I don't think I ever really feel that stressed. So, I mean, either you're wrong or your system's wrong, or I just have a stress issue that I didn't know about. And maybe, and genuinely, maybe I just need to look into it just to make sure I'm not trying to mask from myself something that could be potentially a mental health issue. It's fascinating.
That's very interesting to hear. And what I can tell you just from anecdotal evidence that we have is we get used to living in a certain way with many things, right? And that after some period of time, it becomes sort of your baseline state. And sometimes we get used to things that hopefully one wouldn't get used to, right? And we had a very interesting experience using this with the armed forces in Mexico, where they are subject to a brutal amount of stress. And they would walk into a room and you would ask them, "How are you feeling?" And they're like, "I'm fine." But you could see visibly they were shaking. They couldn't stop like jerking their legs and everything. And when we tested, yeah, their readings both from voice and from the camera based parameters, they were through the roof in terms of stress levels. But that was their baseline, right? They were used to it.
Where are we at with Medsi AI? And where I'm asking now, is this being rolled out to people around Mexico, or are you doing it via the Mexican health authorities to end users? What's going on there?
Our business model is based on B2B and B2G. So we are marketing this directly to whether it's insurance companies, large corporations, pharmacy chains, diagnostic chains on the business to business side. And obviously, an obvious application of this is for government, right? I think they have a vested interest in trying to move from reactive care to preventive care, which costs a fraction, maybe 5% of what reactive care would cost. So we are actively working with some of the largest state governments in the country and with the central healthcare system in the country to roll out different applications, starting with population screening projects. I think it's just common sense that before you try to change something, you need to understand it. And in order to understand the state of a given problem, you need to measure it first. So that's where we are. We only received the regulatory approval 3 months ago. So that has allowed us now to start our commercial undertakings in earnest.
That's Manuel Bilal Vasso. And Angelica Murray is joining me for a little bit of comment there. And I mean, so much to say about this. Partly that I was amazed at how much this app could gauge just using my mobile phone. And Manuel assures me it's been through the regulators, that there's enough training data for us to trust what comes up on the app. And of course, this aspect of bringing healthcare to more people. A lot to unpack, Angelica. What's your take?
Yeah, it's quite a fascinating tool, isn't it? Because Mexico's healthcare situation sounds quite brutal. I mean, 55% out of pocket spending. That's quite insane. For context, most developed countries are under 20%. So this idea of turning your phone into a diagnostic tool could be quite life-changing for a lot of people, millions of people, rather. Though I have to say, I'm a bit skeptical about some of those claims, like predicting Alzheimer's 6 years early from a voice sample. That would be quite revolutionary if it actually works. But it sounds almost too good to be true. Yeah, you were quite surprised, weren't you?
I was very surprised. Yeah, especially that the app seemed to think that I was stressed, and I really didn't feel like it. So that's that. Mind you, I did do this test first thing on a Monday morning, and perhaps I'm not at my best on a Monday morning, or maybe I'm just one of those people who does have some kind of underlying issue that needs looking into, and the app is telling me about that. So yeah, it's enough to take seriously, but it's. But yeah, I mean, obviously, I clearly, just talking for myself here, I wouldn't make serious decisions about my health just from using an app. And I guess if Manuel was here, he'd probably say, yeah, that's probably about right. You know, it has to be integrated with the healthcare that you receive from professionals. In this case, you know, in our country, where we complain about our National Health Service here in the UK and access to health, but we do pretty well compared, for instance, to countries like Mexico. But you know, I suppose the point is, not every country, and Mexico is definitely one of these countries, but you know, countries don't have great health systems, and this might be a way of bringing more health coverage to more people.
I hear you when you say about complaining about the national health system. We do that as well here in Brazil. We have really good public health coverage, even though it has its problems. The truth is that more and more we'll see technology supporting healthcare systems, doctors. They're often overworked and with a lot of people to take care of. So yeah, will have to be integrated. What I thought was quite smart about their approach, Metsi's approach, is that they're not trying to go direct to consumers. They're working with governments and employers, which makes more sense for scaling and getting buy-in. So, and also working with this existing power structures probably helps with that regulatory approval that they need.
Yeah, it's true, isn't it? Because I suppose that's one thing a government can do. You would hope that a government that is used to running things at the state level, and of course, most of all, the civil servants behind that government who actually deliver the services, they understand scale. So, as you say, it might make sense going through, you know, more of a government route.
And like exactly. So the one thing that concerns me though is tech literacy for to use that sort of system. Here in Brazil, for example, we have quite a tech savvy population, but a lot of people will know how to use WhatsApp, how to send voice messages, but there are a lot of people that are functionally literate, for example, and in terms of usage of their devices, they don't even know how to secure their phones with a password. So what concerns me is that they won't have as big a coverage as they should because of lack of digital literacy.
Yeah, I mean, that would worry me, especially when we're talking about an aging population. And, you know, I often talk about my 85-year-old mother on this podcast. And, you know, taking her as an example, she was sent by email a load of credentials that would help her use like her iPad app for the National Health Service in this country. And you know, I've installed it on my phone. It works fine. I can order prescriptions. I can book doctor's appointments. And it'd be great if Mum could do that. But just going through the steps to sign up on her iPad, I don't know what she did, but she managed to not make it work. And it was all a little bit complicated. In the end, the system just booted her out and said, you just have to go to the surgery to speak to them to, I don't know, unlock your account or something. So, you know, what should have been making her life a little bit easier and less stressful is involved her having to go all the way to the surgery, to tie up some kind of receptionist somewhere to help her get onto the app. So, yeah, that point about digital literacy among people who maybe are less well off and are not used to having the technology, or maybe just simply be a bit older and they don't adapt so naturally to the technology. These are all barriers, aren't they?
Yes, I had the same situation with my 73-year-old mother here in Brazil, and she can manage just fine, but up to a certain point. When things start getting very complicated, facial recognition and two-step authentication and all that. So yes, it is a concern. So if companies like that will supply services to governments, they will have to make sure that it's accessible enough and easy to use.
Absolutely. All right, Angelica, thank you for that for now.
Hey, it's Sydney Sweeney. I'm not here to tell you to buy American Eagle jeans. And I definitely won't say that they're the most comfortable jeans I've ever worn. or that they make your butt look amazing. Why would I need to do that? But if you said that you want to buy the jeans, I'm not going to stop you. But just so we're clear, this is not me telling you to buy American Eagle jeans.
Sydney Sweeney, Hasbro Jeans.
You see what I did there, right?
Eczema isn't always obvious, but it's real. And so is the relief from Ebglyss. After an initial dosing phase, about 4 in 10 people taking Ebglyss achieved itch relief and clear or almost clear skin at 16 weeks. And most of those people maintain skin that's still more clear at 1 year with monthly dosing.
Ebglyss, lebrikizumab, LBKZ, a 250 milligram per 2 milliliter injection, is a prescription medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds or 40 kilograms with moderate to severe eczema, also called atopic dermatitis, that is not well controlled with prescription therapies used on the skin or topicals, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. Don't use if you're allergic to Ebglyss. Allergic reactions can occur that can be severe. Eye problems can occur. Tell your doctor if you have new or worsening eye problems. You should not receive a live vaccine when treated with Ebglyss. Before starting Ebglyss, tell your doctor if you have a parasitic infection.
Searching for real relief? Ask your doctor about Ebglyss and visit ebglyss.lilly.com or call 1-800-LILY-RX or 1-800-545-5979.
A massage chair might seem a bit extravagant, especially these days. 8 different settings, adjustable intensity, plus it's heated, and it just feels so good. Yes, a massage chair might seem a bit extravagant, but when it can come with a car, suddenly it seems quite practical. The all-new 2025 Volkswagen Tiguan, packed with premium features like available massaging front seats, it only feels extravagant.
Now, if you're a black mother in Brazil struggling to get employment, there's now a platform that's there to support you. It's called Maes Negras, and that means black mothers in English. So Anya's speaking to founder and CEO Thais Lopes.
This is a one-stop shop platform that advances these black mothers through education and economic empowerment. We offer to them mentorship, online programs, and opportunities to generate money. And for individuals and companies, we offer this marketplace to book services or to buy tickets for events or for even courses. And also, we offer tailored opportunities to hiring black mothers for open positions.
How much of a problem is it for black women to find good employment here in Brazil?
It's a very complex question because we are saying about a country that black women was allowed to study in 1950, almost this kind of time. So the access to education was not allowed for a long time. But today we know that we have this powerful energy, and we also have an ancestor reference to take away what we already have, and sometimes we just need some more opportunities to be in a specific place like this event, or just have more access to and the right conditions to go to school, to go to work, because as we know, sometimes these vulnerabilities cause difficulties to, for example, having adequate health, access to health, or access to food. So when we say about people in vulnerability, it's what most impact on this kind of access. But talking about Black Mothers platform, we have one very high qualified baseline for customers. Our customers, our members, Black mothers that are members of our platform, are very high qualified. So they have access to education. They are outstanding professionals. And they just want to say, I also can be at these places, and I want to show up to the world, my power.
And how many members do you have?
Almost 2,000 around the country. We have Black mothers in 25 states. And we have 10% of conversion on paid users.
You are incredibly popular today. I've come to see you about 4 times because I couldn't get through. There were so many people at your stand. Has this been a successful event for you?
Yes, for sure. After 2 years that we began, we are now changing our narrative for the market, focusing on the B2B segment. So it's a new phase of the business because in the beginning we were working a lot on building this community of practice and to learn what we should do. And then now we have a product to show up to the world and say, yes, we are a business, we are a company, and we are not asking for help. We are here to do business with you.
So that's Thais Lopes talking there to Anya. Right, Angelica, there we are. A one-stop platform, they call it, to not just gain access to employment, but things like mentoring, just all those other steps that you need between maybe where you are now and where you need to be to get a meaningful and hopefully well-paid and rewarding job. What did you think?
I think it's probably helpful for us to discuss the situation of Black women and Black mothers in Brazil. Because Brazil has this complex relationship with race. Even though we're sort of portrayed to the world as this post-racial paradise, the reality is very different, and especially for Black women that are navigating motherhood. For example, Black women in Brazil, they are nearly 3 times more likely to die in childbirth than white women. Think about that for a second. We're not talking about just a marginally higher risk. It's a massive disparity. It's about systemic neglect, really. And then there is the economic piece. Black women in Brazil, they earn about 47% less than white men. And that's even before you factor in that motherhood penalty, which is when employers discriminate against mothers. So you got this double hit of racism and sexism that makes financial stability very, very difficult. So having platforms like that, it's really helpful in terms of addressing traditional support systems they just completely miss. Because being a Black mother in Brazil has this unique set of challenges that mainstream services are just not equipped to handle.
And of course, we're talking about the children here as well. That's the other part of the equation. So, children born to Black mothers, whose mother is facing all the challenges that you mentioned, all the discrimination that you mentioned. It's a very difficult start in life, and especially if that child is a girl as well and grows up to be a Black mother herself. So, all the more reason for some kind of help or support. I suppose one question is maybe a slightly difficult one, but do you think something like Maes Negras can it tackle that issue?
It's a huge structural issue, and I think the point here is about having support networks. And but Maes Negras, this platform is not just offering feel good community support, even though that's very important too, for the reasons you just mentioned. They're creating real economic opportunities. So if you have a financially stable home, then these children will have a better start in life. And the fact that they have like nearly 2,000 members and people are generating real income through the platform tells you that they found something that really works. These two stories, Medsi and Maes Negras, they're both examples of something happening outside the usual Silicon Valley bubble. They're solving problems that are impacting millions and millions of people, and people that being traditionally overlooked by traditional systems. The Mexico story is more about tech disruption, and the Brazil story is more about community building, and but they're both filling gaps that governments and big corporations have ignored for way too long.
Great. Angelica, thank you. Shall we finish with a few listener comments, by the way?
Yeah, let's go for it.
We've not heard from listeners for a while. This is from somebody unidentified on Spotify, but they heard our co-production with the Bride Chiller team. We talked all about wedding tech and AI and wedding tech. So this comment says, love the show about wedding AI tech. Who would have thought you could use AI to plan your big day? As always, great insights from both the Bride Chiller and Somewhere on Earth teams. And that, show, the couple of shows, they really landed well, actually. We had quite a lot of response and the listener numbers went up. So happy days.
Yeah,
There we
it
are,
was lovely to have
marriage.
that conversation with Carolina Kia. And she's such a zen kind of person, so calm and collected. And then
Yeah.
she goes on about how she built all these AI systems to plan her wedding. I met her just the other day, actually. And
Really?
asked her, like, how did the wedding go? Yeah, the best day of my entire life. It all went so smooth. And she was just saying, like, the only thing that happened is that we were there, like, uh, during the ceremony, and there was, like, a little bird there, and he just pooped a little bit in front of the couple. And there was that moment, the guest, but
It's a
nothing
moment.
happened. It all went.
There's no AI wedding planning that can deal with that kind of eventuality, really.
Isn't it just?
Technology has its limits.
Exactly.
So, lovely. Also from Facebook, this one from our Facebook group, actually. On Bride the Chiller, on our co-production, Patricia Reichel says, interesting episode. It surprised me. Patricia continues, I need to use AI more in general. Seating plans for my event could be very useful for my events that she puts on. If I were planning a wedding, says Patricia, I would consider paperless post and greenvelope. I'd be looking to simplify and reduce the planning and all the stress and expense. Perhaps brides-to-be feel the pressure to keep up to date with bridal trends. But I never felt that way in 1993, continues Patricia, when I got married. I made my own invitations on my computer, and then I had a professional printer to print them. That's what Patricia says.
Yeah,
Thank you for that.
like
So
that.
good stuff. So do you have anything there, Angelica? Have you seen any listener comments that you would like to share with the class?
I was just thinking about this wedding sustainability. It's such a trend, isn't it? I think I like to see that. It goes against the current of consumer hyper consumerism and trying to do things
Yes.
digitally and more sustainably. I like it. I considered that for my own wedding as well during COVID. I couldn't do much, really. So everything had to be digital, including the transmission of the wedding itself. So yeah, I think we can. It's good, isn't it, to consider things, ways to be less impactful, and in not just weddings but big events.
Yeah, no, sure. So when you go to a wedding, you might be wanting to put lots of makeup on, look absolutely amazing. And this is a talk about this for a smooth radio link here. It takes us to Barbara on LinkedIn, who she saw our YouTube video of Anya trying out a makeup application machine aimed at people with disabilities. Absolutely brilliant machine. Barbara liked it. She says, what a great idea. But the machine is so big. Do they have plans for perfect eye makeup too? Will there be mini machines for topping up on the hoof, as it were? So Barbara coming up with a few suggestions of how that technology could develop.
On the smart lipstick one, I've asked the same question to the developers, when are you going to have mini machines? And they said that's precisely one of the problems. But one of the things that might make it cheaper and accessible to end consumers is 3D printing. So that might be in the horizon. I like that as well.
Marvelous.
Okay, so one from Adam. He's asking, just wondered if you're planning any further crossovers with other Evergreen podcasts. If you are, having had a look through the Evergreen lineup, I thought these ones might suit. And then he lists a few suggestions. The Planted Runner, which is about learning how to run faster and smarter, fueled by plants. I like that as a vegetarian. I like that suggestion. Also, the Game Fix, which is a weekly video game show with news, reviews, and discussion, and the Inside Line podcast, which is about the sport, business, and politics of Formula One. I like that.
Yeah, good suggestions, Adam. We'll see if we can get married to those podcasts as well. We'll check them out. Thank you. Well, Dino, I think that'll do us. So lots of ways that you can get in touch, dear listener. I'm sure you know by now, we're on all the kind of social media. Apart from X, we've retreated. We are X members now. But pretty much everywhere else. And if you're listening to this, you're clever enough to find us, I think. Just search for Somewhere on Earth or SOEP Tech or something like that. You can email us, hello@somewhereonearth.co, hello@somewhereonearth.co. And we're on WhatsApp, so it's code 44 7486 329 484. I did that a bit fast, didn't I? But you can just jog back 20 seconds and listen to it again. So that'll do. We're on the Evergreen Network, as Adam has rightfully reminded us, where they have some fantastic podcasts. You can find out more about being an amazing runner on a plant-based diet and other amazing things via evergreenpodcast.com. You've been listening to Angelica. Thank you, Angelica.
Thank you for having me. Always a pleasure.
Thank you. See you soon. The production manager is Liz Toohey. Our editor is Anya Literovich. And I'm Gareth Mitchell. And thanks finally to our sponsor, Roost. Thank you, Roost. See you soon, folks. Bye-bye.